Make heading obstetrics. 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 Write down first point. Codes are based on codes are based on codes are based on first point. Routine prenatal visits, routine prenatal visits, routine prenatal visits based on trimester, routine prenatal visits based on trimester, and number of gestations. Routine prenatal visits based on trimester and number of gestations. Routine prenatal visits based on trimester and number of gestations. I don't know that. As you know the trimesters, I said in obstetrics, first trimester 0 to less than 14 weeks. First trimester 0 to less than 14 weeks. Second trimester. Can anyone in the class? Second trimester.
14 to 28 weeks.
14 to less than 28 weeks. Third trimester 28 or more. (28 or more). Next point. One gestation equals to one fetus. 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 Next point. Detailed fetal anatomical examination. Detailed fetal anatomical examination. Detailed fetal anatomical examination. Next point. Limited fetal anatomical examination. Limited fetal anatomical examination. Next point. Next point. Transnuchal, TRANS, transnuchal measurement. Trans-knuckle measurement. Trans-knuckle measurement. Next one. Follow-up or re-evaluation. Follow-up or re-evaluation. Follow-up or re-evaluation. Follow-up or re-evaluation. Now, you can note down all the points. Listen, just check all the points. See, obstetrics means pregnant women. What are the codes are based on? First, prenatal visits. That means at the time of antepartum, we need to look for trimester and we need to look for how many gestation. She is a carrier of single fetus, twins like that. Next, physician can perform detailed examination. A physician can perform limited fetal examination or she can go for follow-ups. You can see the codes here 76801, 76801, 76801,
Sir, page number, sir.
76801. Go with the code. 538. 538. See the code everyone. 76501. 801. Sorry. 76801. Are you there, everyone?
Yes, sir.
Yes, sir. Yes, sir. Yes, sir.
76801. Try to see the code. Ultrasound, pregnant uterus at real time with image documentation, fetal and maternal evaluation, first trimester, transabdominal approach, singular first gestation. Each additional gestation, add-on code. 76805, she is coming after first trimester. 8051, 810. 811, detailed fetal anatomical examination. Detailed fetal anatomical examination. 813, knuckle measurement. 815, limited fetal anatomical examination. 816, follow-up or re-evaluation. Just check the codes for 2 minutes. See what are the key terms we need to look for when we are getting obstetrics, ultrasound of obstetrics. What are the key terms we need to look for when we are getting a question regarding ultrasound of obstetrics? Anyone in the class? Anyone in the class? What are the points we need to look for?
Routine prenatal visit based on trimesters and
Okay.
gestations.
Okay.
Uh, Anatomical examination detail.
Okay.
Limited fetus anatomical examination.
Limited fetal anatomy.
Transnuchal measurement.
Okay.
Follow or re-evaluation.
Okay. Question number 20.
Mohan,
Yes.
Mohan, I want to ask, what will be the components of the detailed fetal anatomical examination and limited? How to
Body part of a
differentiate
fetus.
between that?
Each and every body
Huh?
part of a fetus. How are extremities developing?
Okay.
How is heart developing and everything. Limited means they won't check up each and everything. Just they will check how is the position of the fetus. What is the heart?
Limited.
That is what we call it as limited. See, at the initial times of the pregnancy, they will go for detailed fetal anatomical examination. When the pregnancy is progressing and reaching towards the delivery time, they will focus only on three parameters. One is fetal position, another one is placenta location, and third one is heartbeat, fetus heartbeat. That's it. Okay. Question number 20. Just tell me the CPT code. That's it. Either 805 or 816.
76816,
Eight,
sir.
816.
805.
Why? Because she is coming for repeat transabdominal. Repeat means what we call it as follow-up or re-evaluation. Understood everyone?
Yes, sir.
76816. Do one more question. Question number 48. 48. Yeah, Dimple, I will explain the modifier today. Question number 48. Question number 48. Completed. See here, what is the examination done by the physician? Detailed fetal anatomical examination or limited?
Limited.
Limited.
Limited, sir.
Limited fetal anatomical examination. One or more fetuses, only one code. 76815. D is the answer. Any questions in ultrasound of obstetrics when you are reading a code? Are you able to find out the answer? Any difficulties
Sir?
here? Yes, yes.
Sir,
Yes, yes.
sir, here 776, it is an additional code, sir. 76802.
Okay.
It is, each additional gestation means if physician documents two gestations, we can add this code, sir.
Yes, yes, yes. Add-on code is used when for example, here you can see triplet pregnancy means she is a carrier of 3 fetuses. Understood? At that time,
Yes,
we
sir.
will use those add-on codes. For example, if she is coming for prenatal examination, routine examination, she is a carrier of triplet pregnancy, 76801, 802 into 2 times, like that.
Okay, sir. 2 times. 76802 into 2 times.
But here, when you read the code description of 76815, the code description says one or more fetuses.
Yes, sir.
That means you cannot build like that each fetus. Only one code is enough based on the code description.
Okay, sir.
Understood, everyone? The key terms what we need to look for when we are doing ultrasound of obstetrics. First, you just check it's a routine prenatal examination. Then look for trimester and gestational period. Trimester and gestational period. Next one, detailed fetal anatomical examination, limited fetal anatomical examination, knuckle measurement or follow-ups. These are the key terms. Next concept, brachytherapy. 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 Right down. Brachytherapy. Man-made radioactive seed elements. Man-made radioactive seed elements are used man-made radioactive seed elements are used for treatment of malignancy. For treatment of malignancy. For treatment of malignancy.
Sir, radioactive?
Seed elements, SEED, seed elements are used for treatment of malignancy. Can you tell me radioactive substances? Can you name any two radioactive substances? Anyone in the class? Any two radioactive substances? Uranium, thorium, iridium, yes or no?
Yes, sir.
These are radioactive substances. Those substances will be made artificially to treat malignancy. Okay. Next point. The lifespan of a seed is 1 year. 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 Next one. Codes are based on first keep term. Remote after loading. Remote. Underline the term remote. Remote after loading. Remote after loading. In that A. Superficial. Superficial, that means on the surface of the skin. Superficial, that means on the surface of the skin. Surface of the skin. Just put hyphen diameter. What we need to look for? Diameter. Second one. Again I am repeating. Superficial, that means on the surface of the skin. Just put hyphen, write down diameter. Next one. Interstitial. Interstitial or intracavity. Interstitial. Interstitial or intracavity. Interstitial or intracavity. Just put hyphen, write down based on number of channels. Based on number of channels. Interstitial or intracavity based on number of channels. Next point. If physician is not used the key term remote after loading. If physician is not used the term remote after loading. Code it as intracavity. Code it as intracavity. Code it as intracavity. If physician is not used the term remote after loading, code it as intracavity. Code it as intracavity. Next one. Codes are based on number of codes are based on number of seed elements. 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 Simple means 1 to 4. Simple means 1 to 4. Intermediate means 5 to 10. Intermediate means 5 to 10. Complex means more than 10. Complex means more than 10. Now, if the question is brachytherapy, what is the first key term we need to look for in the question? What is the first key term we need to look for in the question if it is brachytherapy?
Remote after loading.
Remote after loading is the key term. If you are finding remote after loading, then what is the subterms you need to look for?
Whether it is superficial or
Superficial,
interstitial.
interstitial. Now try to see the codes. 77767, page number 552. Page number 552. Five 52. Triple 767, are you there? The code description.
Yes, sir.
Yes, sir.
Can you see the code description now? 77767. Remote after loading, high dose radionucleotide skin surface brachytherapy. If you are finding remote after loading, then check for surface or what is the next term I said? 77770, you can see interstitial or intracavity. These are the two key terms we need to look for when you are finding the term remote after loading. Remote. If you are not finding the term remote, then it is just intracavity. See the code description 77761. 77761. Simple, intermediate, complex is there. Simple means how many seed elements I said?
1 to 4.
1 to 4. Intermediate means
5 to 10.
complex
5 to 10.
greater than 10. Understood?
More than 10.
These are the points we need to look for when you are coding brachytherapy. Now see the question. Kumalata, what are the key terms? You are getting a question regarding brachytherapy. What are the key terms you need to find out in the question?
Remote after loading.
If you are finding remote after loading, remote, then what is the next key terms you need to search for?
Surface area or intracavity.
Interstitial. If you are not finding the term remote, then
Intracavity radiation.
okay. Now see question number 30. Do that question number 30. Clear everyone? What is the answer?
77762.
See, is there any remote in the question?
No, sir.
No, sir.
If there is no remote in the question, then it is intracavity. Then you need to look for number. Where is the number here? Number of seed elements. 6 is there. 6 applicators
Yes,
are
sir.
there. 6 comes under intermediate. Yes or no? 77762. Everyone, B is the answer.
Yes, sir.
Understood everyone how to use these codes?
Yeah, yes, sir.
Okay. Next, make heading radiological guide. Yes, yes, yes. Yes, please. What's your doubt?
Sir, in brachytherapy questions, they will mention as brachytherapy or any other key terms they will mention, sir.
They
To
will
identify the question I'm asking.
20, 25. 25 was asking about.
No, sir. No, sir. I'm asking about.
See the procedure name they will.
We have just now.
See without procedure name.
They will mention as brachytherapy or otherwise they will mention any other else.
Yes, yes, yes. Good. See, the difference between a medical coder and a physician is physician who is the one will perform the techniques they can understand, but a medical coder don't have any practical knowledge. It depends upon theory part and verbiage. Definitely they will document the procedure name. Then as a medical coder, if that procedure name is documented, based on the codes, we need to find out the key terms. Understood now?
Okay, thank you, sir.
They will definitely document the procedure name. Next, make heading radiological guidance. Guidance. If I completed guidance, then how many topics are left for you in radiology? On the day one, you have written the topics. If I completed guidance, how many topics are left in radiology? Can you check and tell me what are the topics left in radiology?
Nuclear medicine, sir.
Nuclear medicine. Next, diagnostic ultrasound. 2. These are the 2 topics left, right?
Yes, sir.
Okay. Now, right. Radial guidance. Right. Guidance is of 2 types. Guidance is of 2 types. Guidance is of 2 types. First one, ultrasound. Second one, radiological guidance. First one, ultrasound. Second one is radiological guidance. Next point. Radiological guidance. Radiological guidance is again of 3 types. Radiological guidance is again of 3 types. In that first one, fluoroscopy. 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 Second one, CT means computed tomography. Computed tomography. Computed tomography. Third one, magnetic resonance. Magnetic resonance. Magnetic resonance. Magnetic resonance. Total, how many types of guidance are there? How many types of guidance?
2 types.
2 types. What are they?
Ultrasound guidance and radiological guidance.
Next, radiological guidance is of how many types?
3 types.
3 types.
What are they?
Fluoroscopy, computed tomography, magnetic resonance
Now write down the rule.
image.
If physician performed any surgical procedure, with the help of guidance, code guidance separately along with the procedure code. Code guidance separately along with the procedure code. Code guidance separately along with the procedure code. Make a note. Make a note. If guidance is a part of surgical procedure or code description. If guidance is a part of surgical procedure or code description. Guidance is a part of surgical procedure or code description. Do not code guidance separately. Do not code guidance separately.
Sir, once again repeat now.
If guidance is a part of surgical procedure, or code description, do not code guidance separately. Do not code guidance separately. Go with the page number 541. Or you can see 540. Page number 540. Do you get page number 540?
Yes, sir.
Ultrasonic guidance procedure started. You can see the first one 76937, 76942. Those are the codes ultrasound guidance. Next you can see the same page number 542. Radiological guidance is there. Under radiological guidance you can see fluoroscopic guidance. These are add-on codes. Computed tomography guidance, magnetic resonance guidance. There are 3 types of guidance. I will show you the differences when we need to code guidance, when guidance is a part of the procedure. Can you go with the page number 138? 138. Page number 138. Page number 138. Are you there, everyone? Page number 138.
Yes, sir.
See,
Yes, sir.
to quote guidance separately. When physician is used guidance in performing a procedure, we can code it separately. When it is a part of the procedure, do not code it separately. Can you see code 20604? 20604? 20604? Read the code 20604.
Arthrocentesis, aspiration and injection small joint or bursum with ultrasound guidance with
Guidance is
permanent
a part of
recording
the
and
procedure
reporting.
or not?
Yes, sir.
Okay, can we code guidance here separately?
No.
No, sir.
Understood, everyone, that what I am saying? We can code guidance separately when it is not a part of the procedure or not a part of the code description. Generally, they will document clearly in the code. Guidance is used, imaging guidance is used, or ultrasound guidance is used, fluoroscopic guidance is used. At the time, do not code it separately. Understood, everyone? One more example I will show you. Can you go with the page number? Page number 475. 475. 475. Are you there, everyone? Page number 475.
Yes, sir.
Can you see the code description 644798083? Is guidance is a part of the code description or not?
Yes, sir.
Do we need to code here guidance separately?
No.
No, sir.
Understood, everyone, when we need to code guidance? When guidance is a part of the procedure? If guidance is a part of the procedure, do not code it separately. Otherwise, we need to code guidance separately. That is the key term we need to keep in mind. Try to practice one question, you will understand. Question number 16, 1-6. Question number 16. See, if you are looking as a smart, you can see option A, B, C, D. No need to go with the procedure code and the radiological code. Directly go with the radiology code. Why? Because there are 4 different radiology codes. Try to find out what is the guidance used and you can pick up the answer. Question number 16.
B for Bombay, sir.
What is the guidance used there? CT guidance?
Computer tomography.
Yes or no? CT guidance is a part of which code description?
Yes, sir.
77012. Everyone in the class? Any other answers? Any other answers? Any other answers? Any other answers?
No, sir.
No, sir.
Now you understood when we need to code guidance when guidance is a part. Now you can do one question when guidance is a part. Can you go with the question number 31? 31. 31. Directly with the go with the codes you can understand. If guidance is a part, do not code guidance separately like that.
483. B for Bombay.
Okay. Is that clear everyone? What will be your answer? 31. B for Bombay. Everyone?
Yeah, 64483, sir. Okay.
Now, why? Because guidance is a part of the procedure. That is the rule regarding guidance. Next, make heading diagnostic ultrasound. Diagnostic ultrasound. Diagnostic ultrasound. Diagnostic ultrasound. Diagnostic ultrasounds. Go for diagnostic ultrasound in CPT. Page number. Page number 535. Page number 535. Page number 535. Can you see how many are there? Types of ultrasounds. How many types of ultrasounds are there? A mode, M mode, B scan, real time scan is there or not? On my screen, can you look page number 35?
Yes, sir.
Just write
Yes,
down.
sir.
Ultrasound means high frequency sound waves. High frequency sound waves is used. High frequency sound waves is used to detect. High frequency sound waves is used to detect. Is used to detect the abnormality of a body part. High frequency sound waves is used to detect the abnormality of a body part. Is used to detect the abnormality of a body part. Is used to detect the abnormality of a body part. Next point. There are 4 types of ultrasounds. There are 4 types of ultrasounds. In your book, you just mark it, or you can write down A mode, M mode, B scan, real time scan. A mode, M mode, B scan, real time scan. A mode, M mode, B scan, real time scan. B scan, real time scan. Now, here in this concept, we need to understand ultrasound of abdomen. Make heading. Ultrasound of abdomen. Ultrasound of abdomen. Ultrasound of abdomen. Can you see page number 536, abdomen, first paragraph? How many organs they need to examine during ultrasound of abdomen? You can see that paragraph, abdomen and retroperitoneum in your books, page number 536. Page number 536, abdomen and retroperitoneum. Are you there, everyone? Abdomen and retroperitoneum.
Yes, sir.
You just see the organs. What are the organs? Liver, gallbladder,
Gallbladder,
common
common bile duct,
pancreas,
pancreas,
kidneys,
spleen.
upper abdominal aorta, and inferior vena cava. Yes, sir.
Yes, sir.
Write down. To code ultrasound of abdomen as complete. To code ultrasound of abdomen as complete. First point. 8 organs must be documented. 8 organs must be documented. 8 organs must be documented. Second point, if physician documents unable to examine all the organs, physician documents unable to examine all the organs, unable to examine all the organs, physician documents unable to examine all the organs. Third point, if physician documents some of the organs are surgically removed, physician documents some of the organs are surgically removed, some of the organs are surgically removed. Some of the organs are surgically removed. Next point, if any one of the above statement is documented, code it as complete. If any one of the above statement is documented, code it as complete. Now try to see the code 76700. Try to see the code 76700. Are you there, right?
Yes, sir.
Right. If any one of the above statement is not documented, code it as limited. If any one of the above statement is not documented, code it as limited. Any one of the above statement is not documented, code it as limited. Code it as limited. See question number 25. Question number 25.
Answer D, sir. D for Delhi.
Completed everyone? What is your answer? Here all the organs are examined?
No, sir.
sir.
Only one organ.
One organ is examined, right?
Yes.
Okay. Then what is your answer?
D for Delhi.
7670. Last topic, make heading, nuclear medicine and radiology. Nuclear medicine. Page number 553. 553. From there, the nuclear medicine chapter starts. Directly go for the rule. Page number 560. Page number 560. Can you read that paragraph under therapeutic? Anyone? And make that is the only rule in nuclear medicine. Under therapeutic, can you read the rule?
The oral and intravenous administration codes in this section are inclusive of the mode of administration for the intra-arterial and intracavitary and intra-articular administration also. Use the appropriate injection and or procedure codes as well as imaging guidance and radiological supervision and interpretation codes when appropriate.
Okay, now listen a scenario. For example, a physician prescribed a medication for you. Okay, that medication need to be administered through oral or through into your body through intravenous. That drug can administered through oral, mouth or intravenous. The drug is administered through oral. Can we code for physician work here? Oral administration can we code separately? By reading that paragraph, oral administration is included or we need to code separately?
Separately we can code.
If you see the first two lines,
We need to code it separately, sir.
if you see the first two lines, oral and intravenous administration codes in this section are inclusive of mode of administration. If the drug is administered through oral or intravenous, do not code for administration code separately. It is included. Understood everyone? Then what type of administration we need to code them separately? If it is administered through intra-arterial, intracavity or intra-articular, we need to code administration separately. Then if physician is used any guidance, we can code guidance separately. Again I am repeating, if it is administered through oral or intravenous, do not code administration code separately. Administered through intra-arterial, intracavity, intra-articular, we need to code it separately along with the guidance code. Now try to see this question. You will understand with the help of a question. See question number 33 in your books. 33. A patient with thickening of synovial membrane undergoes a fluoroscopic guided radiopharmaceutical therapy joint injection on the right knee without ultrasound. What CPT codes are reported by the physician? Now, I will go with 79440. 79440. What is the code 79440? If you see here, radiopharmaceutical therapy by intra-articular administration. Now, if I go with the paragraph, can I code for intra-articular administration separately or not?
Yes, sir.
Yes, sir.
We need to code intra-articular administration separately. Can I code here guidance code separately or not? Can we need to code guidance separately or not? You can see here, and as well as imaging guidance. Can we code it separately or not?
Yes, sir.
Okay,
Yes,
now
sir.
see this scenario 79440. Administration code is 20616 and the guidance code is 77002. What is the answer? The answer like that. See, they try to underline that paragraph in your books when you are getting a question from that section. First, you need to see route of administration, if it is a part of the procedure or not. Otherwise, code it separately and guidance code separately. Okay. Next, make heading modifier 26, the last concept for the day. Modifier 26. Modifier 26, right on. Professional services or physician services. It is used for professional services or physician services. Next point. It is used for supervision or interpretation of the report. First point, it is used for professional or physician services. Second point, it is used for interpretation. It is used for interpretation or supervision. It is used for interpretation and supervision. Supervision. It is used for interpretation and supervision. Next point. Do not quote 26 modifier. Do not quote 26 modifier for physician office. Or do not use 26 modifier for physician office. Do not quote 26 modifier for physician office. Now try to learn the scenario. For example, a patient is in my office. I am a cardiologist. A patient is in my office. I ordered ECG. He took my order and went to diagnostic unit. There, the technician performed ECG and he bring the report again to me. Then what I am doing with the report? Just I am interpreting the report. I have done only the professional component. I can use 26 modifier. Or if I am supervising the study how they are performing, it's a professional service. Understood? I am not performing the technique. I am just only interpreting the result or I am just monitoring the technique. This is nothing but professional service. If, for example, if a patient is in my office, I performed ECG and I interpreted the report. That means where is the technique performed? In my office itself. Do not use 26 modifier. Dimple, is that clear? Again, I am repeating. For example, if the physician is only interpreting the report or only supervising the study, that is nothing but professional service. If a physician is performing the technique and interpreting the report, both is done by the same physician. Do not use 26 modifier if it is performed in physician office. Now you can see here the scenario.
Yes, sir. And
Okay, again I will repeat the scenario. You can see with the example. Can you see question number 20? You people coded 76816. Yes or no? It is in the option C and D. Are we able to see question number 20? The option is in both C and D. Yes or no? But where is this technique performed? In the physician office or not?
Not.
It is performed in physician office or not? Yes, sir. Where it is
Yes, sir.
in the
Physician of
In physician's office.
as per the rule, can we use 26 modifier for physician office if a technique is performed by the same physician?
No.
No.
Yes, sir.
Then what is the answer? 76816. Understand what I am telling? See, if any service performed by a physician in his own office, do not report 26 modifier. When we need to use 26 modifier, if any report is interpreted or if the study is supervised, then you can use 26 modifier. Understood, everyone? When you are practicing, you came to know. At that time, if you are having doubts, you can again ask me. And this is all about radiology. We completed 3 sections. One is anesthesia. Next one is pathology. Third one is radiology. Can I take class for you on Sunday? Can everyone will attend or any programs you have scheduled already?
Mohan, I'm outstation on Sunday. I'll be traveling.
Yes, sir.
Okay.
I'm also.
Okay. Then the class is on Monday. Okay. Happy New Year in advance, everyone.
Thank you, Mohan. I want to ask this anything related to IVR you will be telling in this radiology or in somewhere else. IVR questions will be coming.
That I will tell in here. Cardiovascular, the leveling.
Okay.
Vascular families you are asking about, right?
IVR interventional, IVR.
Vascular families. That I will teach in cardiovascular.
Vascular, yeah.
Okay.
Okay. Fine. Thank you.
Happy New Year, everyone. Okay, in advance.
Happy New Year to everyone.
Thank you. See you on Monday.
Happy New Year to you.
Practice those 3 sections what I completed: anesthesia, radiology, pathology. Ask the admin person, he will share you the rationale. Correct yourself. Then if you are having any questions, you can ask me on Monday. Okay. Thank you.
Okay, sir. Thank you.